Hello friends, today we are going to discuss about important pediatric assessment tool called Apgar scores. Let's get on to the video. What is the Apgar score? The Apgar score is a test given to newborns at soon after birth. This test checks a baby's heart rate, muscle tone, and other signs to see if extreme medical care or emergency care is needed. The test is usually given twice, once at 1 minute after birth, and again at 5 minutes after birth. Sometimes, if there are concerns about the baby's condition, the test may be given again. What does Apgar mean? Apgar stands for appearance, pulse, grimace, activity, and respiration. In the test, 5 things are used to check a baby's health. Each is scored on a scale of 0 to 2, with 2 being the best score. Appearance, skin color. Pulse, heart rate. Grimace response, reflexes. Activity, muscle tone. Respiration. Test is assigned a value of 0, 1 or 2 points, and the score is the sum of the 5 areas. Apgar scores of 7 or greater are considered good to excellent, while scores of 3 or less are between 10 and 0. Considered poor. The incidence of neonate death is highest among those with scores of 3 or less. Appearance, skin color. If the baby gets normal colored all over, hands and feet are pink, the baby gets 2 points. 1 point for normal color, but hands and feet are bluish. If the baby looked bluish gray or pale, all gets 0. Pulse, heart rate. If the baby has heart rate above 100 beats per minute, it gets 2. Below 100 beats per minute, 1 point. If the pulse is absent, no pulse, means 0.10. Grimace, reflex irritability. If the baby pulls away, sneezes, coughs, or cries with stimulation, it gets 2 points. Only facial movement, grimace, with stimulation gets 1 point. No response to stimulation, 0. Activity, muscle tone. 2 points for active, spontaneous movement. 1 point if arms and legs flexed with little movement. 0 no movement, floppy tone. Respiration, breathing rate and effort. Normal rate and effort, good cry, 2 points. 1 for slow or irregular breathing, weak cry. 0 absent, no breathing. A baby who scores a 7 or above on the test is considered in good health. A lower score does not mean that your baby is unhealthy. It means that your baby may need some immediate medical care, such as suctioning of the airways or oxygen to help him or her breathe better. Knowledge test. Post your answers on the comment box. Thanks for watching. If you like this video, hit the like button and subscribe to my channel. See you all in the video.